So, welcome. We are so glad to have you all with us for our panel presentation, Veterans Benefits 101. This is part of the We Honor Veterans program, level 5. It's in partnership with Caris Healthcare and Bethesda Hospice Care. I'm Julie Strassman representing Bethesda Hospice Care, and we have Stephanie Leach representing Caris. And today with us, we have two wonderful presenters from the VA. They are both social workers. So we have Meghan Leach, who is a hospice social worker and respite coordinator. And we have Jessica Atkocius, who is a social worker specializing in hospice and palliative care. So we want to welcome both of them. And we're going to go ahead and let Meghan just dive right into her presentation and make the most of our time together today. And Meghan, we'll have time at the end for questions, correct? Wonderful. Okay. So Meghan, whenever you're ready.
All right. So Jessica and I, we were asked to create kind of just a little info on various veteran benefits. There are a ton. So there's going to be a ton of information in here. So we will make sure you guys have a copy because, you'll get sick of us reading each slide. And I guess we will start. So my name's Meghan. I'm the inpatient hospice social worker here at Jefferson Barracks. I also do our inpatient respite coordination, either here at Jefferson Barracks or in any of our contracted nursing homes that provide that. And I've been with the VA this year will be 17 years. All right, I guess we'll just, okay, just a little disclaimer. This is just information that we've kind of collaborated on with, but if you have any specific questions or whatnot, we would direct you directly to Veterans Benefit Administration because we are separate than them. Hold on one second. Make sure I don't get any alerts. All right, so you all can still see that?
Yes.
Okay. I didn't even, okay. All right, back to this. All right, so just a little background on the VA and how we're set up. The Department of Veterans Affairs is kind of set up like the Department of Defense. We all have various, there's different divisions. So we have the Veterans Health Administration, which is what Jessica and I are with, Veterans Benefit Administration, which is where you would probably think of where they're getting any type of compensation financially or like education, or for us, burial benefit would go through them. And then our Veteran Cemetery Administration, which is obviously like Jefferson Barracks or any of the national cemeteries.
And Meghan and I work for the Veterans Health Administration.
And Jessica and I think, are just going to go, we're going to go slide by slide swapping. All right. If I can figure this out. Okay, there you go.
So just some helpful websites. There really is so much information online. A good starting place for, I think what we hear a lot is we have a veteran who we think qualifies for VA healthcare, but they're not enrolled. For sort of internet savvy veterans, they can actually apply online. And for you all, it's a good place to just get some basic information. Before I worked for the VA, I can honestly say I didn't have a good understanding of who qualified for VA healthcare. Um, and it can be different qualifications. Not every veteran who maybe qualifies for things through the Veterans Cemetery Administration, those veterans may not be the same ones who qualify for VA healthcare. So internet can be a good tool, as well as other resources like Meghan and myself do the best we can to help figure out what folks may qualify for. But just some good places to start. We do have like My Healthy Vet, similar to you all. Maybe you all go and see, your primary care, and they might have like a My Mercy or a My Chart. This is our version, is the My Healthy Vet as a personal health record.
All right, and so the VHA, so the healthcare, so where everyone's going to go to see their primary care or who any of their specialists. For us, obviously, the hospice and palliative care specialty. In order to enroll, these are your options. You can either go to John Cochran or Jefferson Barracks, or you can call and they can help you do it over the phone, um, by mail, or online. And in regards to copays, luckily there are no copays for anyone enrolled in hospice care. Jessica, actually, I don't even know. Are there copays for palliative?
Yes, I think that there can be copays. But certainly if you all ever, hear of someone who says, I'm a veteran, I'm enrolled in the Veterans Healthcare Administration, but the copays are they're too much for me. There are things that we can do to help with that. So if for some reason that ever comes up, please keep in mind that we're not just like a health insurance company that you have copays and that's it. We do have resources.
Correct. Yeah. And so the VA is split up kind of in regions. We are, they're called VISNs, and our VISN is 15. So you could see what our area kind of on that map covers. And yes, Jessica's correct. Like we can help with waivers and so forth if copays are too much.
So this is just not a comprehensive, but a list of some of the medical and mental health services that the St. Louis VA has to offer. Not every, different VAs are different sizes, and we're not all necessarily the same, but these are just some examples of the St. Louis VA.
One big thing that the VA does offer is travel benefits, but it's specific to the veteran if they qualify. Um, One thing that you may hear about is service connected, and that is something that's actually deemed through that Veterans Benefit Administration, has nothing to do with us here, but a lot of the benefits here do sometimes relate to the service connection and whether or not you may qualify for some. Um, so, to get travel reimbursement, there's a few things. You could be on VA pension. The pension is actually, I think I have a slide on that later, but for our low income veterans that have served one day during a wartime, if they make less than um, basically the percentage of the national poverty line, then the VA would, and they are disabled, they would provide them with a small pension. Also, special mode transportation. That's one of the things that we probably see a lot in hospice and palliative care, needing, say BLS or ambulance service or wheelchair services. Um, that also has to do with, say, your service connection, or if you're on like a pension. And then recently, in the last few years, we actually have gotten veterans transportation services, which is great. Unfortunately, it's first come, first serve, and they can schedule with the clinic that they're going to see. They can schedule transportation to come and pick them up and bring them home. Also, they do have wheelchair vans, so that's actually been a great benefit. But you do have to plan accordingly because it is first come, first serve. We also have an Uber program, and obviously veterans have to be independent to utilize that. They also have to have their own cell phone in order to communicate with the driver.
We do have dental services here at the VA healthcare, but I would I would say the majority of our veterans don't qualify for dental. If you have a veteran that is needing some, dental assistance and they haven't been seen by VA dental before, it's always good to get in touch with someone at the VA, specifically like their primary care provider, so they can put in a request to see if they qualify for dental. But I find myself giving out resources a lot for like low income sliding scale dental resources. The Kaufman Fund is a big VA veteran resource. I actually don't know much about the Champ VA buy into a dental plan. I don't know if Megan can speak a little more about that.
Yeah, so Champ VA is offered to caregivers of veterans. You have to qualify for that. Basically, if you're the caregiver for a disabled veteran and you have no other access to insurance, Champ VA is something that you may qualify for, and it's kind of like TRICARE. So you'd have to buy into a dental plan, but they do offer it through that. Not many people have Champ VA. All right, so our National Cemetery Administration, basically kind of like what Jessica was saying, some people that may qualify for Veterans Healthcare doesn't necessarily mean they qualify for the National Cemetery. So the best thing to do for that is to do a pre-need assessment, eligibility assessment, and that's the form that we have here, VA 40-10007. That will allow you to identify whether or not the veteran qualifies for any of the national cemeteries throughout the U.S.
The Veterans Benefits Administration, a huge resource, particularly for veterans families, after they may pass. Like there are resources such as like a burial and plot allowance or like survivor's pension that families may look at applying for. All of sort of like financial benefits are typically through the Veterans Benefits Administration. And what I'll tell you is that it feels complicated even to me. It's I do my best to try to point folks in the right direction, but generally, if someone is interested in applying for a benefit through the Veterans Benefits Administration, it's good for them to contact them directly or to utilize like a veteran service officer to help sort of navigate that institution.
Yes, yes, I agree 100%. We even have veteran service officers at Jefferson Barracks and John Cochran to help assist our veterans because it is a whole another beast. Some of the types of compensation that the Veterans Benefit Administration could possibly be paying our veterans and loved ones. Disability compensation, that is if you have been injured during your military career or developed something that has been aggravated by your military career. So this is basically what we would consider service connection. And it can range from 0%, which does not come with any financial compensation, 10%, 20, 30, all the way up to 100%. Dependency and indemnity compensation. So this would be given to survivors of a veteran who also most likely was 100% service connected or died from a service connected disability. And then special monthly compensation would be if you are service connected and like one of the big things, you may get extra than the base for say like the loss of the use of like a hand or a leg. And then special circumstances, um, that is going to be like your clothing allowance. We have a lot of veterans that might have say like a back brace or braces. You would, or like an amputation, prosthetic, you could potentially qualify for a yearly clothing allowance. And These are just some of the other ones, like automobile allowance. There's 2 types of that. To assist you in getting like an accessible vehicle. Oh, this is just more on. Should I just flip through these, Jessica, you think?
Yeah.
This is just kind of more just in depth of kind of what I just went over. Let's see.
And the pension is also a benefit that is through the Veterans Benefits Administration, but specifically for veterans who are experiencing financial challenges. So they have to fall below a certain income. And Meghan, we have listed here at the bottom about how to apply.
These are just additional benefits all through veterans benefits. So aid in attendance, that could be like an additional monthly payment to, say, someone who's on pension but needs higher level of care. A lot of our veterans will apply for this, especially if they're in like our medical foster home program. But say you're on pension and you need assisted living, you could apply for this and you could use that additional monetary money to help because you need that level of care. Housebound benefits, kind of the same as aid in attendance. Individual unemployability, that's if you're like 70% service connected, but yet you are disabled you are unable to be employed due to your service connected disability, you could potentially be paid at the 100% rate. There's that automobile allowance, clothing allowance. I mean, there's a ton.
Yeah, I think all things just to sort of tuck in your back pocket that could be resources for veterans and their families through the Veterans Benefits Administration.
And these are just the school benefits that I think everybody probably has heard of, like the GI Bill. And then we also have like a vocational rehab program that's in addition to that. All right. Well, so this is for like the Veterans Health Administration. This is like our geriatric extended care programs that we offer. And basically, to get any of these, you need to refer your veteran or their caregiver to their primary care provider. The primary care provider is like the gatekeeper here. You need to go through them in order really to get any other services in the VA. On here too is a link of kind of what these are. Most of them
And like
are
in-home
pretty
respite,
explained.
that would be
Yeah,
for non-hospice patients,
correct.
just
Yeah.
to
And
clarify.
then, yeah, our home health aid, we actually are able to potentially put additional hours in with our veterans who are on hospice. We would need the hospice treatment plan. Veterans Directed Healthcare actually has just this year allowed hospice veterans to enroll. And that is basically the veteran gets to choose who they want to be their caregivers. And then the VA would pay. They would pay the AAA, and then the AAA would pay the caregivers. Caregiver support program. That's another program. There's 2 types. One is our general caregiver support program where it's supporting our caregivers. The other one is it's our stipend program. So depending on the veteran and kind of when they served and what their disabilities are, they could also qualify for another monetary stipend, but that is an application process. And our caregiver support program does all the assessments and eligibility for that. Community residential care, so and assisted living. The VA doesn't have any specific homes, but we do have contracts with, I think they said 8. We were actually just talking about this. I think we have maybe 8 or so. A lot of them are south of the St. Louis area, though. Home-based primary care, that is primary care that comes to the home. Unfortunately, you cannot be on hospice and then apply for home-based primary care, but they will keep our veterans who are already enrolled in home-based primary care on if they transition to hospice.
A
Jerry
general
Pack,
rule of
yeah,
thumb is that we don't take away services for veterans when we add hospice care.
good reminder. Jerry Pack is basically just our complex geriatric primary care clinic. Mental health aging resource team is another, lot of dementia, a lot of Alzheimer's. They're a resource team with a case manager, and then skilled home health. So that could be nursing, could be PT, home eval. Let's see. All right, so this is my role, inpatient hospice unit here at Jefferson Barracks. We are not long-term care. That is the one bummer here, but we are here for veterans, that are requiring, say, an intensive amount of care. Could be primarily for symptom management. Our max time for them to come here to Jefferson Barracks is about 90 days, but depending on how they are, about 30 days in, we may be looking at transitioning them out to one of our contract nursing homes if they don't need this level of care. And some of those, examples are, uncontrolled pain, complex wounds, uncontrolled vomiting, respiratory distress that's unmanageable at home, severe agitation or delirium. So inpatient hospice, the process basically, say our veterans are at home, they would contact their primary care provider, or if they are seen in our palliative clinic, they could contact them. Referral happens, utilization review would review it, and then our docs decide whether or not JB is the right place or one of our contract nursing homes. Over here is the list of our contract nursing homes. So inpatient respite, that's the other part of my job. So basically, veterans that qualify for nursing home level of care, doesn't matter about their service connection or not, they're eligible up to 30 nights a year, calendar year, either here at the Community Living Center, which is down here at Jefferson Barracks, or at one of our contracted nursing homes. Unfortunately, inpatient respite is never guaranteed because it's all based off of whether or not there's a bed availability and their needs can be met. Process for inpatient, again, gatekeeper, go to your primary care. They have to have a medical stability evaluation within 30 days, and then there's a whole process of consults and so forth. Also, unfortunately, it's hard to plan for respite. So about a week out is kind of when we know whether or not we will have availability. Let's see. So inpatient respite, pretty much if the veteran qualifies for a nursing home, they would qualify for respite.
And I work in the VA palliative care program. So we have both an outpatient clinic and an inpatient consultation service. Our outpatient clinic, we see patients in person, both at John Cochrane and at our other location, Jefferson Barracks. We also do video visits and telephone visits. And then we also have our inpatient consultation service where we see patients in the hospital that we are consulted on. Um, and just included some information about palliative care there. Our specific palliative care team, we have 3 physicians, 1 nurse practitioner. I'm the social worker. We have a chaplain, a clinical psychologist, and a pharmacist. Can you go to the next slide, Megan?
Yeah.
And then just some information about how palliative care is different from hospice care. So, palliative care, we're seeing veterans typically who are diagnosed with a serious illness, and we really work alongside those other specialty providers that they're seeing. So we have, we work alongside oncology, cardiology. We have really strong relationships with specifically oncology and cardiology. We often see patients in their clinics with them. And really, the goal is to make sure that patients and families have a good understanding of, of their current medical condition. And we try to understand their goals and see what we can do to help support them with those goals. And a huge role that I have is trying to understand these VA resources and trying to make sure that we're putting in place everything that they can qualify for, and also, working with the community to try to engage with those resources as well. Hospice care, we don't, we have hospice care at Jefferson Barracks, but otherwise, the VA, we don't have our own hospice agencies in the community. We partner and contract with community hospice agencies like the ones who brought us all together here. And veterans for hospice care, any veteran that is enrolled in our VA healthcare system qualifies for the VA to pay for their hospice care. It's not based on service connection. And that we really follow Medicare criteria of who qualifies, but just sort of in general, hospice care can begin when a person has a life expectancy of 6 months or less.
All right. Well, I know that was a ton of information in 30 minutes, but we also wanted to give time for questions. And I'm going to stop sharing.
Bye.
See you. See you tomorrow, guys.
Bye.
So
And
you're
definitely
welcome.
these slides will be sent out. That was why we didn't necessarily read things word for word. So you guys would still have the resources, the information.
Everyone, you're welcome to just speak up and ask if you have a question, or you can put your question in the chat, whatever makes you most comfortable.
On one of the slides, I noticed that there was something called a DD-214 mentioned. Can you talk about that?
A DD-214, good term to know. That is the paperwork that veterans get when they are discharged from the military. Super important form. It tells us what their discharge was. Was it honorable? Was it other than honorable? And essentially, any VA resource, hospital, Veterans Benefits Administration, the Cemetery Administration, they're going to want to see that. If veterans say, I don't have any idea what happened to that, or maybe you're working with their families and the families are saying, I have no idea where to find that, you can request a copy of it through the National Archives. And I don't think that we included that in the presentation, but I'll put a little link in the chat with information about how to request something from the archives. You can do it online, and we're actually lucky the National Archives is located here in St. Louis, the office.
And I will just put a plug in there too. There is a way for an emergency request. It's a different fax number, but it's all on probably the link that Jessica is going to be sharing here. And then for the National Cemetery, if you do your pre-need, you don't necessarily need your DD-214. Also, the National Cemetery can also pull your DD-214. Unfortunately, though, they cannot provide it to you, but they can do that for purposes of the cemetery if for some reason you don't have it and cannot get it. quick enough.
And
If
this
you
is Mary
happen to talk,
Thompson. Oh, go ahead.
oh, I was just going to say, if you happen to talk to someone who says, "Oh, I do know where that DD 214 is," just always encourage them to send copies of it to whoever is asking for it. Don't ever part with the original.
This is Mary. I just recently read, and I'm sorry I do not remember the source, but if anyone is interested, if the veteran has lost their medals, they can request duplicates so they can have them replaced as long as, I believe, as long as it is while they are still living. That's what I was found out, and I don't remember where, but a reliable source. Thank you.
Yes, you can for sure. And on that DD 214, it does list all your medals. So when you go to request them, they will require you to have your DD 214. I know we get a lot of questions for that after the veteran has passed, for say like a funeral. Unfortunately, though, the veteran has to be the one requesting it.
I have another question. You talked about how important it is, especially on the healthcare side, for veterans to go through their primary care. Is that their own private primary care doctor or one that's assigned by the VA?
It has to be their VA primary care provider.
And how do they get signed up for that primary care provider through the VA?
Most veterans should
Yeah,
already
enroll.
have a primary care provider that was assigned to them by the VA. We do occasionally get veterans who say, "I'm enrolled in the VA, but I haven't seen my primary care provider in years. I don't know if I have one," and they very well might not have one. In those cases, you all are always, they could call the main line and ask like eligibility if they have any idea who their primary care provider is. Or I get a lot of phone calls, especially from hospice agencies, asking me sort of next steps about how to get someone assigned to a primary care provider.
And one good thing that's changed recently for, say, like our veterans that are newly enrolled or don't have primary care and need one of our contracted nursing homes, our hospice and palliative providers have kind of, before you used to have to wait for primary care to be assigned. Now there's a way that you don't have to wait if that's something you need. So we've been able to kind of find a loophole on that.
Meghan or Jessica, can you talk a little bit more about VSOs and how to get connected to a VSO?
Yeah, so our VSO stands for Veteran Service Officer. We do have them here at Jefferson Barracks or John Cochran. If you were to go to Veterans Benefit Administration off a page, you would be able to select from any of them that are available. They all have offices down there, but they can range from anywhere from like the VFW, like DAV, the Missouri Commission has VSOs as well. And basically, they become the veteran's durable power of attorney over their claim. So they are able to access the information regarding the claim and help them apply for benefits. They can track them. They're able to like contact the benefit administration and they can actually get information. We a lot of times will have people call us and want us to get DD 214s or their award letters but we have absolutely no access to anything in regards to like the veterans benefit side. I don't know if you want to add a few more, Jessica. And you don't have to necessarily be like a member of the VFW, but some people
Right.
are and some people aren't.
Many cities have their own sort of like veteran service officers you can access. There are
So I think
lots of
Missouri
them.
Commission, right, has like
Hmm.
county veteran service officers.
I believe there is a way to sort of search for veteran service officers like in your area that I've looked at before. And I can try, yeah, I can try to drop that in the chat here as well. But they are very helpful people. They don't cost, and they're really benefit experts. And I would highly recommend having veterans and their families chat with them if they are trying to apply for benefits, specifically through the Veterans Benefits Administration. Or if you have a veteran, I hear a lot, someone might say, like, I think that I should really be service connected for my condition. And I'm not, like, they can also help with that as well.
And that's a good point, Jessica. You pointed out, though, they are free. So if you ever hear of somebody that is charging to help them apply for benefits, that's a red flag. Because all of our VSOs are free.
Great, thank you. What other questions do we have from our group today? And like I said, you can just say them out loud or share in the chat, whatever works for you.
Quiet group.
Yeah, I always like to give a moment for people who might be typing away.
This might be a very simple question, but if you have a veteran in your life who has never enrolled with the VA or doesn't know if they've enrolled in the VA or really has no idea where to start, would you recommend starting with those VSOs, or I guess what would be the first step you'd recommend they take?
If they live here
So,
in St.
yeah.
Louis, I would recommend contacting the local eligibility office here. I think Megan mentioned there's an eligibility office at Jefferson Barracks and John Cochran, whichever one they live closer to. And we are very lucky here. We have a wonderful eligibility office. And I know the supervisor really goes above and beyond in that department to try to make sure that everyone who qualifies is able to get enrolled and quickly. So I think in person is best, but
Mhm.
they could also apply online if they would like. I do think it's a little more tricky. You have to like upload documents and answer questions, but maybe some people are much more internet savvy than me and they prefer to do that. But that is what I would do. I don't really think you need to speak to a veteran service officer just to apply for VA healthcare.
Correct. Yeah. So what service programs are available for spouses of deceased service-connected veterans? So that would have been that DIC, the Dependents and Indemnity compensation. Again, it's very specific to that veteran, what their service connections were, what they passed away of, all that stuff. If you even qualify for anything, because not all spouses of veterans that had been service connected would qualify for that benefit. So that is where I would suggest doing like a veteran service officer to see.
Thank you. Any other questions today?
I just want to say thank you in case I don't get a chance to. Thank you for this.
Yes, I know it's a ton of information. And if there's any, at any point you guys have, questions or, you know, we are here to help, but unfortunately, a lot of the questions that we get are benefit related. So we would definitely direct it to like a VSO or down to Paige.
Well, and I think that's so important though, because just knowing who to go to is really the first step. So I think, so often we'll see that there are a lot of benefits available, but we don't know how to get started. So just the information that you provided on what's available and then who to contact in order to get started, I think is really invaluable.
Yeah, I mean, I would suggest any veteran in your life enroll in the VA. See if you're eligible. If they are, the benefits are amazing. I mean, free hearing aids, glasses, durable medical equipment. You know, if you have specialty cares clinics, you could potentially get all of your appointments on one day, and you only get one copay of $50 if you have a copay.
Prescriptions are cheaper.
Prescriptions are cheaper. The VA has a ton of resources, and unfortunately, not a lot of people know of them. So if you know any veterans, I would definitely suggest them get enrolled. We hear a lot that a lot of our veterans don't feel like they deserve it, or there's worse off or whatnot. No, every veteran that served, I feel, is should at least, you know, see if they're eligible. Like we said, though, on all the programs, the eligibility is different, but doesn't hurt to try.
I hear a lot too, you know, I love my primary care provider in the community. I don't want to give them up. And so I see, you know, patients who they have a VA healthcare provider that they see once a year just to keep that contact, that link with the VA. And then they otherwise, you know, primarily see their community primary care provider that they're maybe using their insurance for, and that's fine.
Right. And then and that's another thing, insurance. So we will never bill Medicaid, Medicare, or TRICARE. If you do have private insurance, and you could potentially even we can bill them. But for the most part, a lot of people who do come here just use the VA, but we will not bill other governmental insurances.
Wonderful, thank you. Well, if there are no other questions, Stephanie, will you do our wrap up?
Sure. Well, I just want to thank Meghan and Jessica again for the great information, the great presentation. And if anybody has any questions, we are going to send out the presentation as well as a recording of the video. If you didn't sign up necessarily and just kind of joined from the flyer, please put your email in the chat right now so that way we can make sure to get you all of that information. And if you have any questions, then you can always reply to that email and we will connect you up. Thank you so much again, Julie and Bethesda Hospice for setting this up. Again, I'm Stephanie with Caris Healthcare. Again, if you have any hospice questions or anything, please feel free to reach out to us. And again, thank you so much to Jessica and Meghan. And if you want more information about We Honor Veterans, send us back an email or shoot a question in the chat.
Thank you so much, everyone. Have a great rest of your day.